We all recognize how dedicated nurses are to helping their patients. What's lesser known is just how physically demanding nursing is. In fact, some studies have found that the prevalence of low back pain in nurses is higher than in all other occupations. Therefore, a study by Bauer looked at how neuromuscular exercises might be able to help reduce the prevalence of low back pain in the nursing population. This study was a randomized control trial with two different groups. There was the neuromuscular exercise group and then a control group. The goal of the neuromuscular exercise program was to improve lumbar spine muscle control, improve flexibility, and also increase strength. And this was a 6-month program performed twice per week with each session lasting 60 minutes. The exercise program was kind of a mixture of a couple of other programs. McGill's big 3 exercises were included, so they would do a side plank, a modified curl up, as well as a bird dog. Then they would also do a single leg stretch, a glute bridge, a side lunge, and then also Tai Chi warrior pose to help with motor control and balance. They would also do an exercise where they're working on motor control by picking up an imaginary box, and then they also included various stretches for a couple of different body regions. The study specifically was looking at movement variability, and so what they did was they hooked a couple of sensors up to each of the participants and then had them pick up a box that was equal to 10% of their body weight, and they measured how quickly they performed the exercise and then also the actual biomechanics, so seeing how much variability they performed with each pickup. The results of the study were that for those who were in the neuromuscular exercise group, that they picked up the box with more variability and around the same speed, whereas the control group actually picked up the box with less variability and with an increased speed. And the reason why this is important is when we look at movement patterns for those with low back pain versus those without low back pain, those with low back pain tend to move in a more narrow movement pattern than those without low back pain. And obviously that can kind of set us up to repetitive movement problems because we're stressing the same tissues over and over and over again. The way that I like to describe this is that if you think about a freeway, for example, if all the lanes are open, we can change lanes depending on which one's moving faster, and that's obviously beneficial. But for those with low back pain in this scenario, there's a lane blocked, and so we have less lanes to be able to go through, and that kind of can create some congestion. And then let's say that we remove another lane and we're just stuck to one lane. That would be somebody who has really chronic low back pain and that they have to move in one certain way over and over and over again. Being able to move in a variety of different movement patterns is beneficial, and one of the reasons is because if we have a variety of different options available to us, we can optimize our movement pattern for the task at hand. So if we're actually lifting a patient or having to roll them or help them stand up, we can actually modify how we actually move to have the most advantageous biomechanics for that task, versus if we're stuck with only one movement pattern, then we're stuck with that, and that could be disadvantageous for the actual movement that we're trying to do. One thing that I wish this study would have included was a strength training group, and the reason is because when we look at the neuromuscular exercise group, it's generally all pretty low load exercises. But when we look at the physical demands of nursing, they're generally pretty high, and so strength training would actually match a little bit better, or potentially match a little bit better, because the loads that we're actually training for in the strength training program would more similarly match the loads that we're actually going to experience when nursing. One of the other interesting things that when we look at the study is the control group. We actually don't really know if the control group was exercising or not, so we don't know why the neuromuscular exercise group had better results. It could be that the control group, they weren't actually exercising, and so any exercise might have been an improvement. Or the control group could have been regular exercises, whether it's cardio, strength training, or some other form of exercise. And so it would be nice to know what that control group was so that we can actually try to figure out the mechanism of why there was an improvement in this group.